Hello, and welcome back to the Black Dental Reserve podcast. I'm your host, Dr. Bridget White, and today we're joined by Dr. Erin Issac, a board-certified pediatric dentist in Monroeville, Pennsylvania, near Pittsburgh. She earned a Bachelor of Science degree in Neurobiology and Physiology from the University of Maryland, College Park. And she earned a scholarship to pursue her Doctor of Dental Medicine from the University of Pennsylvania School of Dental Medicine in Philadelphia. To further her knowledge of dentistry for kids, Dr. Erin continued her education with a rigorous residency program at the nationally ranked Children's Hospital of Pittsburgh, where she earned a certificate in pediatric dentistry. At her pediatric dental practice, Winning Smiles in Pittsburgh, Dr. Issac provides preventive and restorative dentistry, dentistry for special needs and medically complex children, dental emergencies and trauma, interceptive orthodontics, oral surgery, and behavior guidance. She also has interest and expertise in facial growth development and how it can affect your child's breathing, speech, feeding, and general growth, along with laser dentistry. Dr. Issac is able to provide these services in various capacities, both in the office and at an outpatient surgical center. Dr. Issac's research interest includes studying the effects of common pediatric health conditions. Her social media following is very large. Her patients call her Dr. Erin, Dr._Erin. And online on Instagram particularly, you're going to see her fanatic about the Steelers, Disney World, and of course her golden doodle pup, Devereaux, who is waiting for her now. So we've got to get through this episode. Anyway, welcome, Dr. Erin. Today, we're going to talk to her about her specialty and her experience as a pediatric dentist. So welcome. Tell me
Thank
more about
you.
yourself.
Thank you so much for
Yeah, so
having
just tell us
me.
a little bit about yourself.
Perfect. Yeah, that was a good intro. I liked
So
it. So as far as me goes, that was a great intro, and that's very accurate. I would say that I am a person who was definitely born and raised in Pittsburgh. I'm a diehard Pittsburgh Steelers, all of the things that you think about with Pittsburgh. That is me. And then I also am a huge Disney buff, which works well being a pediatric dentist, and a dog mom. So it all goes together quite well. But yeah, I love being a pediatric dentist. It's one of those things that I never would have thought that this is where I would end up, along with being a business owner, but it's worked out amazingly and I love it. There are, as a business owner and a clinician, there are definitely the ups and downs, the ebbs and flows, but I love being a pediatric dentist and I love being a business owner.
Yes, yeah. I mean, tell us how you got into dentistry. I've read, following you, I know you come from a family of medical providers. Can you tell us more about how you chose dentistry and just your family background in medicine?
Sure. Yes. My mom is a retired physician. She specialized in radiology, but she was actually the chief medical officer for a state psychiatric hospital her entire career. And then I have two older sisters who are both physicians. So one is an adolescent medicine doc, and the other is a sports medicine physician. Lots of medical healthcare type people in the family, even in the extended family, several dentists as well in the extended family. For me, it was never pressure to get into healthcare or medicine or anything like that. But I think I just, kind of seeing my mom growing up doing what she did, just kind of gravitated towards that. And then also, I was a very artsy, kind of creative, hands-on type of person growing up. So combining both the creative artsy side with healthcare medicine, dentistry was the perfect fit. So I ended up shadowing my cousin, who was a dentist who lived in the area, went to his office, kind of saw what dentistry was all about. This was back in like college or high school or something. And I was like, oh, that looks really cool. So I applied, I got into dental school, and the rest is history.
I mean, this is like a legacy profession in your family. That's wonderful. I remember when I started school and I was surprised that so many people followed their parents' path into dentistry. My dad was an accountant. My mother's a teacher, and I really, I almost wanted to do the opposite of what they did. So it sounds like that was really foundational for you. But do you consider your family members your mentors, or who is the go-to person for guidance?
Yeah, that's a great question because though my mom and my sisters are all in medicine and healthcare, as you very well know, dentistry is quite different from medicine. Starting all the way back in dental school, like they couldn't quite understand why I was so exhausted in dental school because you have the didactic, you have your classes and lectures, but literally from day one, pretty much you're hands on in some capacity, whether it's in, the
Mm-hmm.
pre-clinic labs, that type of thing. So it's a different world. So yes, they were great mentors as far as taking care of people in a healthcare role. But I would say that as far as dentistry itself, it was kind of turning towards other or family members who are dentists, and then along the way, finding mentors in school, in residency, finding those people who I was like, oh, I love what they're doing. And we just kind of connected. And they're the ones who have helped me out a lot along the way as well.
When did you decide to specialize?
Good question. So actually, I didn't figure that out until I would say it was maybe like end of third year, beginning of fourth year in dental school. So I was a little bit later to the game than most people. Um, as you go through dental school, you get to go through the specialty clinics. And as you know, you go through the specialty clinics and kind of rotate, oral surgery, oral medicine, emergency, orthodontics, all the things. And as I was going through, I was like, don't want to do that. Don't want to do that. And I knew I didn't want to do general dentistry as well. So it almost honestly was a process of elimination. And funnily enough, my mom from the beginning of dental school, my mom was like, "Oh, you should really consider pediatrics." But I also knew that she had early in her career wanted to do pediatrics, so I was like, "Oh, she's probably just trying to get me to do something she never got to do." But it kind of ended up being that's what really worked out well. I guess sometimes our moms know us well. But so that's what I ended up gravitating towards. And during those rotations in school, you don't get a ton of pediatrics in dental school, but those few that I did have, I really made sure I was paying attention, soaking in everything that I could. And I really, really liked it. So I ended up thinking, oh, I could definitely make a career out of this. And that was that.
You mentioned that your family members are dentists. Did you consider going into practice with anyone in your family?
Well, only one of them is around Pittsburgh, and I pretty much had determined I either wanted to be back home in Pittsburgh after dental school or down in Maryland near where I went to undergrad. And my one cousin who practiced here in Pittsburgh, he was a general dentist with a smaller office, not really wanting to have a pediatric dentist in his office. So after residency, I was like, I probably can't practice with him. So I ended up just working at a couple of different offices in the area, and then decided that nothing was wrong with those offices. I just decided I think there's other ways of doing pediatric dentistry. So then by way of that, I decided that I wanted to open my own office and went for it.
What do you like about having your own practice?
Ooh, there's a lot. I like being able to a degree to set my own hours, set my own schedule. Like I set our 2024 schedule already, but I always say the very first thing I do is set all the holidays and the vacations. So I like being able to do that. And it's very important.
Mhm.
I also really like just being able to incorporate new things. Like you said in my bio, in my intro, I'm very much into, airway, sleep, tongue ties, those type of things. And I'm able to learn more about that and just really put that into practice in the office. You're not always necessarily able to implement new things or newer ways of thinking. There is some controversies around performing frenectomies, things like that. You're not always necessarily able to implement those type of things when you don't own your own office as an associate. So I really love that. And just being able to practice how I want to practice. We're more of a boutique style office. So we definitely take our time with all of our patients. We're not just rushing them through, turning kids in and out. We really sit, get to know the kids, get to know the parents, come up with individualized plans for them. So just being able to practice how I want to so that I can make a longer career out of it is one of the best things.
Yeah, and you have one location, correct?
Yes.
Have you thought about expanding, opening up another location, growing your office?
Someone asked me that the other day. Being a practice owner is a lot of work. I feel like I never say never, but I feel like I am pretty good with the one office that I have. We still have a little bit of room to grow here at this office. So I'd rather kind of max that out first. And then if I really feel like I want another project, perhaps do a second office. It's funny because my sister, the adolescent medicine doc, she practices in Cleveland, and she's always like, we have no one to refer our patients to. You should set up an office here. And I'm like, oh, it would be fun, but there's a lot of work with, as you know, that goes along with opening, running, managing an office. So right now I'm good with the one location.
Yeah, I agree. It's a lot. I mean, I know a lot of people will say if you want to have a business that has to be able to grow, but it's hard being the provider as well. I think if I'm able to step back as the clinician and be more of a business owner, then I think I can grow in that capacity.
Yep.
So, I mean, what is your patient base like? I mean, I'm from Philly, so we have a pretty, I know Philadelphia is probably a little more diverse with regards to the Black population than Pittsburgh. Can you tell me about Pittsburgh's demographics and then specifically your patient base?
Yeah, sure. So, Pittsburgh, there's definitely not as large of a Black or African American population as in Philadelphia. And Philadelphia is just a much larger city than Pittsburgh in general. But I will say in my office specifically, one of the reasons I set up shop where I am is because it is this intersection of a lot of different populations. And I mean, you name it, race wise, religion wise, culture wise, language wise, you name it. And I pretty much have it in my office, which I'm super proud of. I absolutely love it. I mean, it's just incredible the diversity that comes through our office. We also pull from a lot of different areas around us. So not just Pittsburgh, but I mean, even out towards the middle of the state, up north towards Erie, we have patients who regularly come to see us from Ohio, West Virginia, Maryland. We have patients who lived here but moved away to ones in like Seattle, over in California. We have patients who now live in Africa, and literally every time they're home, they come to see us. So like we're getting patients from everywhere, which is really good, I think, for the other patients and parents to see as well when they walk through the door. But it also helps us as clinicians and healthcare providers to really have that diversity in the office. I love it. I absolutely love it.
Yeah, I'm sure your patients really appreciate it. I think that, it's more rewarding for me personally to be able to see a diverse patient population. I often find that many Black patients are very happy to receive treatment and find providers that look like them.
Yeah.
How do you feel with Black families? So what's the feedback that you get with your Black patients and their families? I know that you do a lot for education. The children, the experience with your child as a dentist is one that really leaves the biggest impression
Yep.
for a lifetime of oral health.
Yep. Yeah. I get great feedback from everyone, but especially the the Black families or parents of Black children, because I do have a good bit of families that are other race or culture who have adopted a Black child. But so I get a lot of really great feedback, a lot, especially the little Black girls. They're so cute. And you can tell they're just like, their eyes get really big and they're like, oh my goodness, she looks like me. And I always make it a point to say, hey, our hair looks the same. Or, hey, we kind of have like the same skin color. And I definitely point that out. Like, I'm not shy about it at all, because I think it's important for them to realize and see that, they can do something like this as well, or just in general, whatever they put their mind to or want to be, they can do it. So I definitely get a lot of really good feedback for that. And then honestly, I get a lot of really good feedback from a lot of, like I said, it's a very diverse population. So I get a lot of really good feedback from multiple cultures, religions, things like that, about just being open and welcoming to everyone in the office. Even we have a lot of patients who don't speak English really well. There's a big, I should say, and like there's one main area that I'm thinking of in Pittsburgh that has a big immigrant population, and a good bit of those patients do come to our office. So they're always very excited to find someone who will take the time to actually try to understand them language-wise, but also understand differences in cultural practices and things like that as well. So, I mean, I think the feedback has been pretty great.
That's great to hear. I remember at Penn, Dr. Erin and I are a few years apart. I was class of '07, but I remember very vividly our lectures on cultural competence, body language. We
Yep.
we spoke specifically about women in East Asian cultures, and I lived in Japan when I was 10, so I remember
Oh,
Japanese women, body language, family position, and cultural norms. So I was shocked to read that only 18% of dental schools teach cultural competence. I mean, that's really disappointing for the profession. But a lot of research shows that it really is that patients want providers that look like them, that have
mhm.
the same racial identity, and how we treat our children, and with regards to healthcare and education, says a lot about our priorities as a
Agree.
nation. I think that we can do much better. And I've just read that, it's so preventable, dental decay, right? Brush and floss,
Mhm.
but there's so much neglect and abuse. And so as a pediatric dentist, what is your impression in terms of, dental decay rates? And do you feel like there's something the government can do? Do you feel like it's a social awareness, education problem? I'd like to hear what's your impression?
Oh man, that's a can of worms. There's a lot. I'll try to keep it brief, but there's a lot. So number one, I think, is education, or maybe miseducation. Um, that, oh man, I'm about to get on a soapbox. That
We want it. We want it. You're the
that
expert.
right. That dental care in general, or just teeth in general, are either not important or separate from everything else in our body. So that, layered with baby teeth that are just going to fall out anyway, it kind of lends itself towards whatever happens, happens. It's not that big of a deal. But it really is, as you know, baby teeth, like they're not just like this thing you're going to lose and doesn't cause any issues. You can have a lot of issues if cavities progress into abscesses, progress into, infection that can spread throughout the body. We can have a lot of issues. Other health conditions as well, as you know as well, are linked to dental decay, gum disease, things like that, diabetes, heart disease, high blood pressure. There's even some studies that show premature labor, having babies that are born premature, can be linked back to gum disease during pregnancy, vitamin deficiencies during pregnancy there's just so many, so many things that can happen that I think people are just thinking about cavities, or I don't have a cavity, so I'm fine. But that's not necessarily always the issue. Like we said, I'm very much into all dental health and wellness and how that affects the body. There's like, if we're not getting proper growth of our face and our jaws, that can lends itself to issues with sleep disordered breathing, which can then turn into sleep apnea as you get older, which increases your risk for high blood pressure and heart issues, things like that. So there's just so many things that trickle down from it that many of us are, and it's not a blame game, but it's more so, I mean, there's a lot of dental professionals who aren't even aware that these things are related to each other. So I think just educating the public is really important, especially as it goes with dental health in kids, because that's your baseline. Like if you're not getting that down and getting down the importance of and taking care of your teeth when you're younger, then it's only going to trickle into adulthood. And that's how you get the adults who are either afraid to go to the dentist, or when they do, now we have all these things happening. And now you have all this in-depth treatment that needs to be done. And yeah, you're probably going to end up not loving the dentist because you're there 15 times getting all these things done because maybe we weren't aware of the potential consequences or how important dental health is. You know, we weren't made aware of that when we were younger. So now it's been pushed into adulthood as well. So a lot of that. And yes, we definitely talk about brushing, flossing, how important those things are. Again, a lot of people might not think that brushing and flossing are that important for kids, but it is. We talk about those things. Yeah. We talk about those things, but there's also a lot with diet and environment that can also play as much of a role as, maybe sometimes even more so, than brushing and flossing. You also asked about the government. There's always more that they could be doing. But that's another story. But I think also too, like programs that help children who with like food instability or food insecurity, things like that. I think really making healthier foods available would be helpful. A lot of times the things that are available in these programs are things like pretzels and chips and crackers and things that can also lead to cavities, which also people aren't aware lead to cavities. So they're like, oh, this is like, if I wasn't sure where my next meal was coming from and that's what I was offered, of course I'm going to take it. So I totally get that, but also knowing that these are some things that could also then lead back towards getting dental decay. So it's like a tangled web of so many things, but that's dental health in general. There's so many factors that go into causing dental decay. So there's so many different pain points that we could reach. But I know that was kind of all over the place. There's just so many things that go into it that I could talk
really
about that for hours.
It's a feedback loop. You know,
It is.
we don't have the education. We don't provide the proper education, and then we don't provide the proper nutrition. And then the healthcare providers are scattering to do the treatment, and then they also need to educate, but they have to have compassion. And also there's a void because the children or the adults aren't able to either learn how to care for the mouth or just don't have it as a high priority.
Exactly.
I think just the way they've separated the mouth and the eyes from the body, yes. I don't understand that. Exactly. But what I have, what I will say is, in general, dental insurance is not really insurance. It's sort of a benefit program, if you may, right? And I think that it's our population, regardless of age, adults as well, they have this idea that dental insurance is like medical insurance. And then they're shocked to find out that it doesn't really work that way. And unfortunately, I spoke with Dean Wolf at Penn at a Penn event last month, and he said point blank, America has decided that dental care is a luxury.
Mm-hmm.
And it's a shame, but that really is the truth. It's a
Mm-hmm.
luxury, and there are providers who are trying to fill the voids and help the marginalized populations. But
Mm-hmm.
then that affects your ability to practice the dentistry that you want, the way you want, and
Exactly.
also afford the education
Exactly.
that you received and the lifestyle that you have to lead.
Yep.
So I feel like my hands are tied as well. It's
Mm-hmm.
difficult.
Mm-hmm.
I worked in public health. I tried to help in certain ways, but I look around and it is disappointing to see that only a third of our peers are even taking public insurance. But in terms of the Black population, they say that although we're only 3% of the dental workforce, we provide for half, 50% of all Black patients.
Mm-hmm.
So this doesn't surprise me. I work in DC, and I have many patients who will come specifically looking for a provider,
Yep.
or just based on the fact that I see patients that work for government or different organizations that are in the area. But I think that your background is quite remarkable. You've come from a family of healthcare providers, that you value healthcare, that you prioritize oral healthcare and pediatric healthcare. It's like it's like a Venn diagram, and I think it gives you a unique perspective. And I can tell you're passionate. I mean, your videos are great. I love when you're like in the mirror showing, and I think you just said something that stands out that's very timely. You talk to the patients who look like you, and you talk about those shared characteristics.
Mm-hmm.
And I think about the Little Mermaid movie that came out, and oh gosh, those pictures of Haley Bailey, hugging those little girls. That is something that's so impactful, and that type of representation, whether you want to be a princess, a mermaid, or a pediatric dentist, it's so great that patients can look to you. So do you have any words of, what's your call to aspiring Black dentists, or maybe people that haven't considered dentistry? Because I know that sometimes parents, they scatter to get their kids interested in professions that they feel will, afford a good quality of life.
Mm-hmm.
My parents, they wanted me to be an engineer, a lawyer, a doctor. It was like, you could do these 5 things. Luckily, my parents, that's how I grew up. But it wasn't beyond me to consider dentistry. I'm a Black dentist. I lived in Philadelphia. Again, my parents, gave us a lot of access. So, but what would you say to our population, to parents especially?
Yeah, that's a really good question. And I love that you were able to be exposed to Black dentists growing up like that. Like we just talked about, that's a big part of the battle as well. But for Black parents, I would just consider, a lot of times, like you said, these are the things that you should aim for to be, as your career, talking to our children. But remember, dentists are doctors. I think a lot of times when we say doctor, we mean like be a neurosurgeon or something but dentists are doctors as well. And we're there as well. But I think remembering that it's a really good career path, and you really do get to truly help people. Like we're saying, there's so much that oral health affects the rest of the body, or the rest of the body is affecting oral health. It's just, like we said, a feedback loop. But just remembering that this is a path that's open to our children, and there's a lot of need for people that look like us in this field, because people are searching for either themselves or for their children to have a dentist that looks like them. So there's a lot of opportunity there. There's not a ton of us in the dental field. It's growing, but there's not a ton of us. I think last time I checked, there's something like maybe 600 or so Black female pediatric dentists in the whole country. So there's definitely, yeah, there's definitely room for growth there. I know it's crazy. It's crazy. But there's room for growth there and it's much needed. I think also too, going back to the patient perspective, a lot of times, at least with kids, they're more apt to taking recommendations and things like that from either someone who looks like them or just someone who's really passionate about what they do. So having someone who is able to instill those like healthy tips and recommendations into the kids in a way that the kids actually absorb is really important. And I found that, yeah, like I said, like a lot of times our Black children will kind of take more of that information from someone who looks like them because they're like, oh, they must know what they're talking about. We probably have shared, a 5-year-old isn't necessarily saying that out loud, but their brain is thinking like, oh, they look like me. I'll do what they say, things like that. So I think that is really important to keep that open mind that this is a really good profession that can really help a lot of people, and we are much needed in this profession.
Well, thank you. Thank you so much, Dr. Isaac. We are going to team up and do some promotion. We're going to talk about being dentists.
Yes.
Pennsylvania natives. Dentists. I mean, I'm an Eagles fan. I'm can't get down with the Steelers.
You're one flaw.
I've been to Pittsburgh a few times. It's a beautiful place. I've read it's now like a great diverse patient population for a reason. So please continue to keep having these, especially young girls, smiling and giving them confident wings.